Throughout history, certain individuals emerge as beacons of knowledge and innovation. They cast a profound and enduring influence on the trajectory of human progress. Among these pioneers is Abu al-Qasim Khalaf ibn al-Abbas al-Zahrawi. Renowned as al-Zahrawi, he stands as a towering figure of the Islamic Golden Age, illuminating the realms of medicine, surgery, and scholarly inquiry. Born in the waning years of the 10th century in the radiant city of Medina al-Zahra, nestled within the splendor of the Caliphate of Qutbah, his precise birth and passing dates remain cloaked in the mists of time, yet his legacy persists as a testament to the heights of human intellect and compassion. Al-Zahrawi's odyssey through the corridors of learning and discovery unfolded against the vibrant backdrop of Qutbah, a thriving epicenter of knowledge, culture, and intellectual exchange during an epoch held for its prolific advancements in science, art, and philosophy. Immersed in the rich tapestry of Islamic scholarship, al-Zahrawi honed his intellectual acumen under the tutelage of eminent scholars, immersing himself in the wisdom of the ancient individuals before him while nurturing a fervent curiosity that would propel him towards pioneering frontiers in the field of medicine. Fueled by an unquenchable thirst for knowledge and a relentless dedication to scholarly pursuits, al-Zahrawi ascended as a luminary of medicine and surgery with his magnum opus, al-Tasrif, assuming the mantle of a seminal treatise that traversed the vast expanse of medical knowledge, unraveling the intricacies of human anatomy, pharmacology, and surgical techniques in unprecedented detail. Within the sprawling expanse of its 30 volumes, his compendium stood as a testament to al-Zahrawi's erudition, astuteness, and meticulous attention to the details of medical practice, solidifying his stature as a preeminent authority of his era. Yet al-Zahrawi's enduring legacy transcended the confines of scholarly erudition, resonating through the corridors of time as a testament to his boundless compassion and unwavering commitment to the noble art of healing. In an age where the realm of medicine often intersected with the frontiers of human suffering, al-Zahrawi's emphasis on ethical conduct and empathetic patient care echoed the essence of his humanity, delineating him as not merely a master of medical science, but also a harbinger of compassionate healing and holistic well-being. As the resonance of al-Zahrawi's indelible contributions reverberated across the tapestry of human history, transcending the boundaries of the Islamic world and permeating the intellectual fabric of medieval Europe, his pioneering insights and innovations continue to reverberate in the annals of contemporary medicine, serving as an enduring testament to the profundity of his intellect, the level of his teachings, and the enduring legacy of a scholar whose luminous spirit transcended the boundaries of time and space. Al-Zahrawi embarked on a journey of intellectual enlightenment and scholarly pursuit that was profoundly shaped by the formative experiences of his early life. Born in the latter half of the 10th century in the vibrant city of Medina al-Zahra, ensconced within the resplendent Caliphate of Qutbah, al-Zahrawi's upbringing unfolded against the backdrop of a flourishing Islamic civilization pulsating with the vibrancy of intellectual discourse, cultural exchange, and scholarly endeavors. Amidst the tranquil yet intellectually charged Medina al-Zahra, al-Zahrawi's nascent years were likely shaped by the captivating allure of the arts, sciences, and literature that thrived within the Islamic courts and centers of learning. Surrounded by the intellectual luminaries and erudite scholars of the era, his formative years were imbued with the seeds of curiosity, fostering an innate inquisitiveness that would germinate into an insatiable thirst of knowledge and intellectual exploration. His early education, presumably undertaken in the bustling intellectual precincts of Qutbah, laid the foundations of his later scholarly pursuits, nurturing his intellectual acumen and honing his cognitive faculties under the guidance of esteemed mentors and erudite scholars of the Islamic Golden Age. Mentored by renowned physicians, scholars, and theologians, al-Zahrawi's early forays into the realm of medicine were undoubtedly shaped by the rich legacy of Islamic scholarship and the profound wisdom of the ancients. Imbued with a reverence for the classical texts and treatises that epitomized the zenith of scientific inquiry and medical knowledge, al-Zahrawi's studies were marked by a deep engagement within the works of ancient luminaries such as Hippocrates, Galen, and Avicenna, whose seminal contributions to the realms of medicine and philosophy would serve as a guiding beacon in al-Zahrawi's intellectual odyssey. In the hallowed corridors of his early education, al-Zahrawi's inquisitive spirit was ignited by the intellectual fever that pervaded within the Islamic world, compelling him to unravel the enigmatic complexities of the human body, probe the intricacies of medical practice, and immerse himself in the profound tapestry of medical knowledge that permeated the annals of Islamic civilization. As he delved deeper into the realms of medicine and surgery, al-Zahrawi's early studies not only laid the groundwork for his future accomplishments, but also instilled in him a profound appreciation for the amalgamation of scientific rigor, empirical observation, and compassionate patient care, principles that would define his illustrious career as a preeminent physician, surgeon, and the scholar of the Islamic Golden Age. Al-Tasrif, the magnum opus of al-Zahrawi, stands as a monumental compendium of medical knowledge and surgical expertise that reverberated throughout the annals of the Islamic Golden Age, leaving an imprint on the fabric of human understanding and medical practice. Composed of 30 volumes, the seminal treatise represented the zenith of al-Zahrawi's intellectual prowess, epitomizing his comprehensive mastery of medical science, surgical techniques, pharmacology, and ethical principles, thereby solidifying his stature of one of the preeminent authorities of his era. Al-Tasrif served as an all-encompassing repository of medical knowledge, offering a comprehensive elucidation of the intricacies of human anatomy, pathophysiology, and the nuances of various medical ailments, bolstered by a meticulous analysis of diagnostic methods, treatment protocols, and pharmacological interventions. It not only encapsulated the cumulative wisdom of the ancients, but also provided a holistic approach and framework for the understanding and treatment of the myriad of medical conditions that plagued humanity during that particular era. Of particular significance was al-Tasrif's comprehensive exposition of surgical techniques, which constituted a groundbreaking contribution to the field of surgery and laid the groundwork for modern surgical practices. Al-Zahrawi's meticulous delineation of surgical procedures, accompanied by detailed illustrations and step-by-step instructions, revolutionized the practice of surgery, elevating it to a realm of precision, efficacy, and scientific rigor previously unparalleled in medical history. Furthermore, al-Zahrawi's meticulous cataloguing of over 200 surgical instruments, many of which he designed and developed himself, served as a testament to his innovative spirit and engineering acumen. Instruments such as forceps, scalpels, and specialized surgical tools meticulously detailed in al-Tasrif not only enhanced the intricacies and precision of surgical interventions, but also paved the way for the evolution of surgical instruments that are still in use in contemporary medical practice today. This underscoring the enduring relevance of his contributions to the field of surgery. Al-Tasrif's enduring impact extended beyond the confines of the Islamic world, as the treatise was translated into various languages, including Latin, during the medieval period, disseminating al-Zahrawi's profound insights and medical expertise across the European continent. Its translation and dissemination catalyzed a renaissance in medical knowledge and surgical practice, nurturing a profound appreciation for the empirical rigor and scientific inquiry and compassionate patient care that underpin al-Zahrawi's enduring legacy as a pioneer of medical science and surgical innovation. Thus, al-Tasrif stands as an immortal testament to the intellectual acumen, compassionate ethos, and pioneering spirit of al-Zahrawi, casting a timeless radiance that continues to illuminate the realms of medical science, surgical innovation, and compassionate patient care, thus inspiring generations of medical practitioners and scholars to aspire towards the loftiest ideals of healing, compassion, and intellectual enlightenment. Al-Zahrawi made groundbreaking contributions to the field of surgery not only through his pioneering of surgical techniques, but also through his innovative designs and developments of a multitude set of surgical instruments. These instruments, meticulously documented in his seminal work, Al-Tasrif revolutionized the practice of surgery, enhancing precision, efficacy, and patient outcomes. Al-Zahrawi's ingenuity and engineering acumen were manifested in his creation of over 200 surgical instruments, many of which laid the foundation for modern surgical tools and procedures. One of al-Zahrawi's notable innovations was the refinement of the forceps, a pivotal instrument used in various surgical procedures for grasping, holding, and extracting tissues or foreign objects from the body. His advancements in forceps design facilitated the delicate and intricate surgeries, enabling surgeons to perform complex procedures with heightened precision and reduced risk to the patient. The scalpel, another fundamental surgical instrument, underwent significant refinement under al-Zahrawi's meticulous craftsmanship. Al-Zahrawi's modifications to the scalpel design improved its sharpness, durability and maneuverability, allowing for more precise and controlled incisions during surgical interventions. This innovation paved the way for enhanced surgical precision and minimized tissue trauma, thereby contributing to improved postoperative recovery and reduced morbidity. Furthermore, al-Zahrawi's repertoire of specialized surgical tools encompassed instruments such as retractors, probes and specula, which played critical roles in facilitating access to surgical sites, exploring anatomical structures, and improving visibility during intricate surgical procedures. These instruments were meticulously crafted to meet the diverse demands of surgical interventions, reflecting al-Zahrawi's keen understanding of the intricate dynamics of surgical practice and the necessity for specialized tools to optimize surgical outcomes. Among his innovations, al-Zahrawi also devised various surgical hooks, drills and saws tailored to specific surgical requirements, such as bone cutting, tissue retraction and wound closures. These instruments not only streamlined surgical procedures but also underscored al-Zahrawi's commitment to enhancing the efficacy and safety of surgical interventions, reflecting his profound insights into the intricate nuances of surgical practice and his dedication to advancing the frontiers of medical science. Al-Zahrawi's meticulous attention to the design and functionality of surgical instruments revolutionized the landscape of surgical practice, setting a precedent for the evolution of surgical tools that continue to underpin contemporary medical practice. His pioneering contributions to the development of surgical instruments exemplify his enduring legacy as a visionary scholar and innovator, whose profound insights and technical acumen continue to resonate in the realms of surgical science, engendering a culture of precision, safety and innovation that remains the cornerstone of surgical practice. Al-Zahrawi not only left a mark on the history of medicine and surgery through his unparalleled contributions to the field, but he also distinguished himself through his profound commitment to ethical conduct and compassionate patient care. His unwavering dedication to the noble art of healing was shaped by a combination of personal ethos, cultural influences, and the profound teachings of Islamic ethics, which understand the sanctity of life, the imperative of empathy, and the importance of ethical conduct in the realm of medical practices. Embedded within the fabric of Islamic teachings, al-Zahrawi's ethical conduct and compassionate ethos were deeply rooted in the Islamic principles of mercy, benevolence, and social responsibility. His adherence to the Hippocratic Oath, a testament to his commitment to the moral and ethical obligations of a physician, exemplified his unwavering allegiance to the principles of beneficence and patient autonomy, thereby underscoring his reverence for the sanctity of human life and the imperative of upholding the dignity and well-being of every patient under his care. His emphasis on compassionate patient care was not only a reflection of his profound empathy and humanistic values, but also a testament to his understanding of the holistic nature of healing, which extended beyond the mere physical realms of medical intervention. His compassionate bedside manner, characterized by attentive listening, empathetic communication, and personalized care, fostered a profound sense of trust and rapport between the physician and the patient, thereby laying the foundation for a therapeutic alliance that transcended the confines of medical treatment and embraced the essence of healing as a holistic and humanistic endeavor. Furthermore, al-Zahrawi's ethical conduct was underpinned by his profound sense of social responsibility and his unwavering commitment to serving the marginalized and underserved segments of society. His ethos, exemplified through his provision of medical care to individuals from diverse social and economic backgrounds, reflected his steadfast belief in the equitable distribution of healthcare services and the imperative of addressing the healthcare needs of the marginalized and vulnerable segments of society, thereby upholding the intrinsic values of compassion, justice, and societal well-being that epitomize the essence of Islamic ethics and humanistic values. Al-Zahrawi's ethical conduct and compassionate patient care were not merely a product of cultural or societal influences, but were deeply ingrained within the fabric of his moral character and personal ethos. His reverence for the sanctity of life, his unwavering commitment to the principles of beneficence and compassion, along with his profound sense of social responsibility, remain a testament to his enduring legacy as a paragon of ethical conduct, compassionate patient care, and humanistic healing. This transcending to the boundaries of time and space to inspire generations of medical practitioners and scholars to embrace the noble virtues of empathy, integrity, and social responsibility in the pursuit of the noble art of healing. Al-Zahrawi continues to resonate as a towering figure in medical history, leaving an enduring legacy that transcends the boundaries of time and space, illuminating the realms of medicine, surgery, and compassionate patient care. His profound contributions to the field of medicine and surgery, encapsulated within his work Al-Tasrif, stand as a testament to his unparalleled mastery of medical science, surgical innovation, and ethical conduct, underscoring his enduring impact of the trajectory of human understanding and medical practice. Al-Zahrawi's revolutionary insights and innovations in surgical techniques and instruments have not only shaped the foundations of modern surgical practices, but also continue to underpin contemporary medical interventions, serving as a beacon of precision, efficacy, and compassionate patient care that remains an integral part to the ethos of modern healthcare. His meticulous documentation of surgical procedures, coupled with his pioneering designs of surgical instruments, has paved the way for the evolution of surgical science, enabling generations of medical practitioners to embrace the ideals of precision, safety, and innovation that epitomizes the essence of modern surgical practice. Moreover, Al-Zahrawi's unwavering commitment to ethical conduct and compassionate patient care has transcended the confines of history, inspiring contemporary healthcare professionals to uphold the noble virtues of empathy, integrity, and social responsibility in their practice. His humanistic ethos, rooted in the Islamic principles of compassion and benevolence, continues to serve as a guiding light for those seeking to embrace the holistic dimensions of healing, transcending the mere physical realms of the medical intervention and embracing the profound essence of patient care and humane healing that lie at the core of the medical profession. As the resonance of Al-Zahrawi's contributions echo through the corridors of time, his enduring legacy remains as an immortal testament to the profundity of the human intellect, the virtues of ethical conduct, and the enduring spirit of compassionate healing that transcends the boundaries of culture, creed, and time. Al-Zahrawi's contributions continue to inspire generations of scholars, practitioners, and humanitarians to aspire towards the loftiest ideals of scientific inquiry, compassionate patient care, and societal well-being. This reflecting the timeless resonance of a scholar whose luminous spirit continues to illuminate the noble spirit of healing, knowledge, and humanistic excellence. Thank you for taking your time to listen to this biography. Please like, comment, share, and subscribe, and we'll see you at the next one.